this is the pathway. We have two pathways. Mainly these are two pathways for synthesis of vitamin D. We usually follow this pathway. This pathway is seen in plants. I mean from the plants, and this pathway is seen in animals. Okay, so this is the pathway of vitamin D synthesis. See here what happens, first 7 hydroxy cholesterol, it is a cholesterol. This cholesterol is present in liver as well as in adipose tissue. Okay, in adipose tissue we have cholesterol. This cholesterol is converted into cholecalciferol, which is inactive form of vitamin D3. This cholecalciferol is converted in the presence of sunlight in the skin. This cholecalciferol again goes to liver, and in liver this cholecalciferol is converted into 25 hydroxy cholecalciferol. This is 25 hydroxy vitamin D, 25 hydroxy vitamin D, which is also called 25 hydroxy cholecalciferol. And again in kidneys what happens? In kidneys this 25 hydroxy cholecalciferol is again activated totally into 125 dihydroxy cholecalciferol. 1 comma 25 dihydroxy, two hydroxy groups are added. I mean one is already there in liver, one is added in liver, and the second one is added in kidneys. So this is 1 comma 25 dihydroxy vitamin D, which is also called calcitriol. So this is the active form of vitamin D. Now this reaction is seen from the cholesterol which is present in the skin. That means this total synthesis process is occurring in animals, especially in all mammals. In all mammals this synthesis process occurs, and our our skin, liver and kidneys, these three are important in manufacturing vitamin D. We don't want to, we can't depend on other sources for vitamin D. Our body itself produces vitamin D with the help of cholesterol. This occurs in animals. Now you see this plant related vitamin D synthesis I will explain now. So this is ergocalciferol, which is commonly seen in plants. We have so many plant sources, like we have nuts, cashew nuts, we have peanuts. Okay, all the nuts contains some form of cholesterol which is called ergocalciferol. This ergocalciferol, which is taken from the plant sources, is entered into the liver. In the liver this ergocalciferol is converted into 25 hydroxy calciferol, and again this 25 hydroxy calciferol in the kidneys, it is converted into 125 dihydroxy ergocalciferol. Okay, so here we have to add ergo because it is ergocalciferol is obtained from plants. So whenever we take ergocalciferol from plant sources, this ergocalciferol will be converted in our body into vitamin D2 form, active form, which is called 125 dihydroxy vitamin D or ergocalciferol. These two forms are very similar. Both of them are active form, but it is called vitamin D2, which is obtained from plant sources, and which is called vitamin D3, which is synthesized in the animal. Both of them are synthesized in the animal tissue only, but the source, primary source here, the ergocalciferol is coming from plants, and here cholesterol is coming from the skin, from the animals. That's it. So this is the these are two different process through which vitamin D is synthesized in our body. Vitamin D2 is obtained from plants, vitamin D3 is synthesized in the animals. Clear? Now you know the difference between D2 and D3. We have D1 and D4, D5 also. Anyways, those different other forms of vitamin D's are not that much important, but you remember this. In most of the formulations we synthesize vitamin D as ergocalciferol only. Okay, and when ergocalciferol dietary sources of vitamin D2 are given, always remember that patient is having liver function as well as kidney function. If anybody is not having proper liver function and kidney function, in those cases ergocalciferol is not suggested, because to activate this ergocalciferol into vitamin D2 active form, liver and kidney is important. You have to remember this before suggesting to the patients. We have to make sure that it is active form or inactive form, and patient's kidney and liver function is also maintained. Now you see it is very important here. You understood the vitamin D concept, PTH concept, calcitonin, actions of calcitonin also. Now here this concept also we have seen, the activation of vitamin D by kidneys. Here one important thing,